confidence. We all can possess it, but sometimes a little tweak here and there can make you feel that much more confident. What's one of the things people see right away when they meet you? They see your hair. Dr. Robert Jones, you know all about this topic.
It's my full-time job is taking care of people's hair, and I've been specializing in hair loss for about 4 or 5 years now.
Right.
And my practice is full-time, and as we were discussing before, it's a big problem for males and females,
and women.
Especially women. It's a huge issue. When a woman's hair thins, it's much more devastating for them than it is
There's more of a
men.
stigma, I think.
There is, for sure. I mean, men, it's sort of acceptable to lose their hair and to be bald, but when a woman loses her hair, it's very upsetting. It's,
well, I mean, I came in and told you, I'm coming to this from personal experience, which people may not, because I was good at hiding things, but I went through a time of alopecia, which to me, I thought I was the only person in the world, first of all, that was going through this weird women's hair loss thing. And yet it's something that I should have come here because you could have helped me, but I just dealt with it.
Yeah, well, quite often people, I see women every single day in the office, and quite often they'll go to their doctor, and basically they're just pushed out the door and told to just wait, and it'll probably come back, and one of those things where there are definitely things you could do to help sort of restore thinning hair. So I would strongly suggest any woman that does have thinning hair to seek good medical advice and do something about it. I mean, there's basically for females...
Yeah, I was going to say, what kind of options are there for women?
Well, the first thing we do with females is just make sure there's no medical reason for their hair loss.
Which can be...
thyroid dysfunction, autoimmune diseases, other sort of illnesses, and plus medication. A common one is Accutane, you know.
For the skin treatment.
For skin treatment. I actually saw 2 women this week who came in because they were started on Accutane, their hair was thinning, and they were never told that may happen from medication. Birth control pills, pregnancy, stress. There's a lot of things that are treatable and reversible. Once you've sort of ruled out medical causes, there's one good medication that can do something to restore hair, and that's minoxidil or Rogaine.
Oh, yes.
And it's a lotion that you rub. The minoxidil that you get over the counter is 2%. In women, you can also use 5% at night, and that will definitely increase your hair volume by 20 or 30% if it's used regularly for 6 months or so.
Excellent. This is good to know, so that if you're sitting at home and you're where I was thinking, okay, I'm the only person with these weird round patches missing all over my head, it is something you can come to someone like yourself and address.
You can, for sure. There is something you can do about it. The other thing is cosmetic hair thickeners. Now, these have become incredibly popular in the last few years, and there's a few on the market. In fact, I've private labeled one, Instant Hair Cosmetic Hair Thickener, and what you do basically is just, you have to have hair for it to work. But if you do have hair, what you can do is sprinkle it in, and it will...
It's like a camouflage.
Well, it's like makeup, but it looks so natural. It's amazing how it can sort of thicken up a hair that appears thinning, and it's perfect for females.
Yes.
It is, because it basically can, and you've tried it.
Well, I know, when I was going through my second pregnancy, and I did lose just these, almost like where the men lose that little bit of hair here, and it was masked for the time until it came back.
Right, you can make your scalp look, you can't see your scalp anymore, so you don't get that see-through look. And, and when people are looking at you from the top, you can't see your scalp anymore, which really is what is very upsetting to females.
And it's amazing with that little bit of help during that time, it can raise your confidence level immensely.
For sure. Now, there's a number of different colors. Now, the color that I use is dark brown, and I thought, as you can see through to the skin on the top of my head. Now, if you take just a little bit, it's just like a salt shaker, and what you do is you just shake it in your... It doesn't take a lot. You just sprinkle it in, and by sprinkling it, you can and then rub it in. Now, I run, and I can put this in. Doesn't come out, because everybody's always concerned, is it going to run down my forehead, or is it going to come out? But as you used it,
I didn't have a problem with it,
because it sticks with electrostatic forces to your existing hair and doesn't come out. It's an amazing product.
It's a remarkable product. The other thing I wanted to mention while I'm here is, I didn't necessarily think of it, but eyelashes. That's another form of hair that people will lose.
Eyelashes and eyebrows I did a televised eyelash transplant about 2 years ago on a local TV station, and since then I probably do 3 or 4 or 5 eyelash and eyebrow transplants per month. It's become incredibly popular, and it is for females especially, and quite a few Asian females will come in because they have short eyelashes, Asians especially, and it is definitely very popular.
Wow. So we would encourage people that if you're dealing with any of these things, at least come in and talk about it.
For sure.
That's step one.
Most of the time with hair loss or eyelash or eyebrow loss, there is definitely something you can do about it.
So what I'd say, come on in, and you have a website where people can take that first step.
drrobertjones.com.
Easy as that.
Yeah.
Well, we want to encourage you to come on in and at least take the consultation. Find out what your options are, because there are some. There's more on Real Life coming up.
Coming up on Real Life.
For increased child safety.
Well, and we all have woken, any parent can relate to being woken up in the middle of the night with a sick child, and you're